Hi, my name is Eloy, and I'm doing a presentation on COPD for Speech and Hearing Sciences, CSD 341. I wasn't able to get the Zoom to record my presentation as planned, so I'm kind of winging it here with the phone. And I'm going to walk you through a PowerPoint presentation on chronic obstructive pulmonary disease. So here we go. So, COPD, what is it? Like I said, it stands for chronic pulmonary obstructive disease. And typically, there's two main types, most common. The COPD, though, in more definition, is an ongoing restriction or obstructions of the airway of the lungs caused by irritation and inflammation inside the airways, typically the linings of them. It's limiting airflow, which is the obstruction, and usually results in chronic coughing and excessive mucus within the airways. So, what causes COPD? It's most often caused by long-term exposures to irritants in the air. Most of these irritants include smoke, fumes, chemicals, and dust. Long-term exposure to tobacco, first and second-hand smoke, is the most common cause of COPD. Like I said, there's two main common types of COPD. The first one's emphysema, which is characterized by damage of the tiny air sacs of the lungs called the alveoli. When these sacs are damaged, it makes it difficult to exchange gases like O2 and CO2 within the lungs and the bloodstream. That can actually result in elevated red blood cell production. Chronic bronchitis is a second form of COPD. It's characterized by constant inflammation of the linings of the tubes that bring air out of the lungs. These tubes are known as the bronchi. When the bronchi are inflamed, the passageways are narrowed and makes it very difficult to draw in and out air. So it can restrict your breathing. So here's a diagram kind of depicting that bronchitis there, chronic bronchitis, where your bronchi is basically narrowed, becomes like a garden hose that's pinched off, so its pressure is kind of increased. And then here's the emphysema, which from the inside out kind of knocked down and destroyed the walls of the alveoli sacs, and it decreases the surface area. So that's why you have a hard time exchanging that oxygen and carbon dioxide in the bloodstream. So symptoms of COPD is cough with mucus that you've had for a long time, typically 3 months or longer, maybe at least for 2 years. Difficulty taking deep breaths, shortness of breath, especially when performing daily activities with mild exertion. You'll have wheezing or other kind of lung sounds. You may develop a barrel-shaped chest from reserving too much air in and not being able to exhale it. And your skin might actually turn blue from having COPD. Risk factors that for developing COPD, I guess you're more likely if you're female, if you are over the age of 65, if you've been exposed to toxins in the air, or have worked around chemicals, dust, or fumes. There's a genetic component. You may have alpha-1 antitrypsin deficiency, and if you've had many respiratory infections as a child, have asthma, or definitely if you're exposed to first-hand or second-hand smoke is definitely one of the major causes of COPD. So COPD's effect on respiration and phonation, it obviously affects the ability to take deep breaths in and out and your tidal breathing by shortening it. This can affect phonation by reducing the ability to provide the necessary subglottal pressure to blow open your vocal folds. It can also affect the ability to sustain effective phonations for longer sounds. COPD can also interfere with your ability to maintain regular breathing patterns associated with swallowing or dysphagia. COPD can lead to vocal dysfunctions, including hoarseness, breathiness, vocal quality, and decreased intensity. So what are the SLP's roles in managing the symptoms of COPDs? Well, together with a respiratory therapist, SLPs can help manage various symptoms brought on by COPDs. They can help manage dysphagia, like I said, with trouble swallowing due to irregular breathing problems. SLPs have the knowledge and skills to assess cognitive deficiency and know strategies to help efficient patients learn new information. And for older adults, they may suffer from cognitive deficiencies associated with COPD and strokes. So they can also address and assess and address problems associated with vocal dysfunctions like vocal intensity and vocal quality. So I have a personal connection to COPD. My grandma on the left there, she had suffered from emphysema for many years due to smoking, and I saw her state decline. Unfortunately, there is no cure for COPD. It's just a manageable treatment. She was on oxygen, and she used a nebulizer quite often. And she eventually, I think, had complications with pneumonia, which caused her death. And the character on the right was one of my cats named Mishkers. He ended up having feline COPD, which they took an x-ray of his lungs, and there should be black in the x-rays in their lungs for air, but his was like a cloudy white or grayish color, which means he had like zero lung capacity. Problems with Mishkers is he had to lay down every 3 or 4 feet. He would walk and catch his breath for a few minutes, and it was really sad to watch him decline. Unfortunately, he ended up having a heart attack due to his COPD, and and it affected him quite deeply, and it affected me. So that was just a personal story I wanted to share. That COPD can affect anyone, but make sure you don't smoke and that you watch the chemical or irritants that may be in the air, pollutants and stuff, that you're not constantly breathing that stuff in, because it can lead to COPD, and you do not want to end up with chronic bronchitis or emphysema, because it's nasty for sure. So here are my references for my report here, and I want to thank you for watching, and have a good day.